Good evening, all. I welcome everyone to our live class session, online class session, and I believe we all had a good day. So we on week 5 of the course title NSC 303, and today we'll be looking at Unit 4. And Unit 4 title is Organization of Health System based on primary health care. But before we start today's facilitation, can I see the hands of those who managed to download the PowerPoint instructional video of this unit before this class session? If you managed to download the instructional video and you were able to go through it before now, can I see by the show of your hands, or type yes on the chat? Okay. I've not seen anyone yet, but let me quickly remind us again that it is not optional but compulsory for us to always download the materials provided on the page, on the VLE page, and try to go through it before the live, before the online class session. I always say that, okay, Ronke, thank you so much. Thank you so much. I can see the hand of Ronke. Okay, Yusuf. All right, thank you. For those of us that managed to download the instructional video and went through it, thank you so much for making that effort. I know everyone is busy, but we just have to create that time. And for those of us that we've not been able to do that, please, let's encourage, let's try and go through the materials that is provided for us before the class session. It is very important. And so we are going to continue today's class. In my introduction, I have mentioned that we are on Unit 4. And in the interest of those that are joining us for the first time since the semester or the class began, we normally have quizzes in between the class. So whenever I ask questions and I ask you to put the answers on the chat, know that it's a quiz and it's going to be rewarded. So it's important to know that so that you can make an informed decision whether you will respond or not. So in Unit 4 of today's study, Unit 4 is divided into 2 parts. So today we are covering part A of it. So by next week, we'll cover the part B of Unit 4. Kindly note that. I said the title is Organization of Health System based on primary health care. And so for Ronke and Yusuf that managed to download the material, can you quickly, okay, before I ask what you were able to understand from the instructional video that you downloaded, let me quickly share with us the learning goal for this course. You bear witness with me that every week and every topic we cover as a learning objective. That is, at the end of facilitating that course with us or that unit with us, what learners are expected to be able to do. And so I'm just going to share with us the learning goal for Unit 4, Part A. So, as you can see on the screen, we have learning goals for Unit 4. After studying this unit, learners should be able to define health system, list the characteristics of health system, describe the organizational structure of health system at federal level, state level, and local government level. And finally, learners should be able to explain the roles and organization of National Primary Healthcare Development Agency. Excuse me. Excuse me. So that is the learning goal for Unit 4, Part A. And in this Part A of Unit 4, we'll briefly be looking at the definition of health system along with the essential characteristics of health system, in addition to the organization health system structure at federal, state, and local government level. And so, because today I have the privilege, Ronke, okay, Yusuf, at least you managed to download the instructional video. What can you share with us on the meaning of health system? For those of us that managed to download the instructional video, what do you understand from the material? What do you understand by health system? Can I share from your thoughts? Let the class share from your thoughts. You can put your charts, put it on the charts, and it will be read in our hearings. What do you understand by health system? What is the meaning of health system from the PowerPoint instructional video that you earlier downloaded and you listened to and you read? I'm assuming if you raise your hand that you downloaded it, I assume that you managed to go through it. So, what do you understand by health system? I'm waiting. Ronke, Yusuf, you raised your hand. So tell us what you understand by health system. Okay. Let me assume that you are typing it. In the meantime, health system simply means a coherent whole of many interrelated component parts, both sectoral and intersectoral, as well as community itself, which produces a combined effect on the population. That is the simple definition of health system. It simply means or defined as a coherent whole of many interrelated component parts, both sectoral and intersectoral, as well as community itself, which produces a combined effect of the population. That is the definition of health system. And this health system, okay, are things put together to enhance the healthcare of the people or population. Thank you, Temitope, for that trial. Health system is an organization that collaborates into health and community. Thank you so much for those contributions and the efforts. So, like I just defined it to you now, that it is a coherent whole of many interrelated component parts. You understand that health system, it encompasses many components made up health system, and they are both sectoral and intersectoral, as well as the community itself. As well, this health system has components. What are those components? The following are the components of health system: concepts, ideas, objects, and person. I'm just going to quickly share my slide on that. What do I mean by concept, ideas, and object? When we say concept, these are the components of health system. When I ask you to mention the component of health system, whether in an assignment or in exam, just remember there are concepts, ideas, objects, and person. And when we say concept is simply, example of a concept is health and disease. While example of idea is coverage, the effectiveness, or the impact, while the object is the hospital and the health center. And lastly, the person example is the provider, the health provider, and the consumer. And so I'm just going to share with us the slide that I just explained. Like you can see on the screen, meaning and characteristics of health system. And I define it as a coherent whole of many interrelated component parts, both sectoral and intersectoral, as well as community itself, which produces a combined effect on the health of the population. The component of health system includes concepts, e.g., that is, for example, health and disease, ideas, objects, and person. And so we've seen that the health system, in addition to the component of health system, the health system also have aims. And what are the aims of healthcare system? It's simply the delivering health service to the beneficiaries. And who are the beneficiaries? The beneficiaries are the consumer, the citizen, the member of a nation. And so it is also to develop continuous and progressive improvement of health status of a population or a community. So these are the two aims of health system of every nation. One, like I mentioned, is to deliver health services to the beneficiary. And two is to develop continuous and progressive improvement of health status of the community or the population. The health system encompasses promotive, preventive, curative, and rehabilitative aspects, and also provides cares of the extremely disabled and incurable. And so we've seen briefly the component of health systems as well as the definition of the health system and the aim of the health system. And so we want to quickly look at the essential characteristics of the health system based on primary health care. The health system encompasses entire population on the basis of equality and responsibility. It is a responsibility to give equal or fair health service to the people, to the population. It includes components from the health sector and from other sectors. And what we mean by other health sectors, we have interrelated sectors that makes health system functionable. And you want to look especially from the primary health care base. You want to look at the education sector. You want to look at the animal husbandry. You want to look at the agricultural sectors. So all these sectors are interrelated to contribute to health system. We have three levels: the primary health care, we also have the state level, and we also have the tertiary level. When we say primary health care level, that is at the local government level. We call it the grassroots level. It consists of at least the essential elements as we discuss under Unit 2 of this course. That during the Alma Ata Declaration Conference, essential element or component of primary health care was itemized, and this component must be given or must be achieved at the primary health care level. Then we have the intermediate level. The intermediate level is more or less like is at the state level now. It deals with more complex problems, and you have skilled, specialized care being handled, and logistic support are provided at the state level, which is the intermediate level. At this level, you have better trained staff, and supervisory staff should also be providing continuing training to PHC, that is primary healthcare workers. For those who work at the primary healthcare, continuous training is given to them to empower them to deliver effective and efficient health service to the community. And so you looked at the central level. The central level is more or less like a tertiary level. It coordinates all parts of the system and provides planning and management expertise. It also provides highly specialized care, teaching for specialized staff. This clearly indicates that health system is not a separate entity. It includes components and actions, not only from the health sector, but also from other health-related sectors, such as agriculture, education, environment, animal husbandry, communication, and at various levels. So we've just looked at we've just mentioned the three levels of healthcare system that we have in Nigeria. And briefly, we are going to unpack each of these levels. We'll look at the organization level of federal government, the health system organization at federal level. We'll look at their function. We also go to the intermediate, which is the states. We also look at their functions. We also look at the grassroots level. So for now, let me pause to entertain contribution. So far from what we have covered, I would like to entertain your contribution or your question on what we have covered so far. For those of us that we are live in class, can you type in your contribution, or if there is any question on what we've just covered so far, can you put it on the chat before we proceed? Okay, while you are typing your contributions or your question, like I always say every week, that this is a facilitation, this is not a lecture. If it is a lecture, I will expect you to just expect me to deliver to you while you listen. But because this is a facilitation, I'm supposed to facilitate the class while you contribute, while you drive the class. But because majority of us do not manage to go through our provided materials, that is why we are not effectively contributing in the class session. And please, I'll continue to encourage us until the semester ends. It is very important that we download our instructional materials, go through them, read them, come with questions to the class session, so that you can have the class more interactive. All right, I'm going to proceed to the next slide, which talk about the federal level organization system. When we say the federal government level, the tertiary is another name for tertiary level. What does it entail, and what is the function of the federal level health system? So I'm going to share quickly with us what the organization of at federal level is. It consists of the Federal Ministry of Health, the National Council of Health. These two comprises the federal level. At the federal health system level, we have the Federal Ministry of Health, the National Council of Health. What is the function of the Federal Ministry of Health? Excuse me. The Federal Ministry of Health function is headed by a minister. It is a political appointment. Currently, the Federal Ministry of Health has 5 directorates or departments, which includes Department of Personnel Management, Department of Finance and Supplies, Department of Planning, Research and Strategies, Department of Hospital Services, and lastly, the Department of Primary Health Care and Disease Control. That is basically the function of the Ministry of Health. What is their responsibility? They also have, in addition to their function, the responsibilities that is expected of them. And one, as the Federal Ministry of Health, they are expected to take the necessary action to have reviewed national health policy and its adoption by the federal government. 2, devise a broad strategy for giving effect to the national health policy through the implementation by federal, state, and local government in accordance with the provision of the Constitution. 3, submit for the approval of the government, of the federal government, a broad financial plan for giving effect to the federal component of the health strategy. Formulate national health legislation as required for the consideration of the federal government. Lastly, acts as coordinating authority on all health work in the country on behalf of the federal government with a view to ensure implementation of this national health policy. Assess the country's health situation and trends, undertaking the related epidemiological surveillance and report thereof to government. Promote an informed public opinion on matters of health. Support states and through them local governments in developing strategies and plans of action to give effect to this national health policy. Allocate federal resources in order to foster selected activities to be undertaken by states and local government in implementing their health strategies. Issue guidelines and principles to help states prepare, manage, monitor, and evaluate their strategies and related technical programs, services, and institutions. Define standards with respect to the delivery of health care and monitor, ensure compliance with them by all concerned with health technology, including equipment, supplies, drugs, biological products, vaccines, in conformity with World Health Organization standards. The human environment and the education training, licensing, and ethical practices of different categories of health workers. Promote research that is relevant to the implementation of this national health policy and state health strategies. And to this end, to establish suitable mechanisms to ensure adequate coordination among the research institutes and scientists concerned. Promote cooperation among scientific and professional groups as well as non-governmental organizations in order to attain the goals of this policy. Monitor and evaluate the implementation of this national policy on behalf of government and report the findings. International health. The Federal Ministry of Health set up an effective mechanism for the coordination of external cooperation in health and for monitoring the performance of the various activities within the overall foreign policy objectives. This national health policy is directed towards one, ensuring technical cooperation on health with other nations of the region and the world at large. Ensure the sharing of relevant information on health for improvement of international health. Ensure cooperation in international control of narcotic and psychotropic substances. Collaborating with United Nations Agency, Organization of African Unity, West African Health Community, and other international agencies on bilateral and global healthcare improvement strategies without sacrificing the initiatives of national community. Working closely with other developing countries especially the neighboring states within the region which have similar health problems, in the spirit of technical cooperation among developing countries, especially with regards to exchange of technical and epidemiological information, sharing of training and research facilities, and the coordination of major intervention programs for the control of communicable diseases. So we've just looked at the meaning of the Ministry of Health, which is under the federal level. And don't forget that I said that it comprises of the Ministry of Health and the National Council of Health. And so we've just finished the A part, and I'm going to quickly go into the part B of it. Okay. Okay, when I said there is a question here, can you please explain component of health system? I didn't get it right. I simply mentioned that the component of health system is concept, idea, objects, and person. That is the 4 components of health system. And an example of concepts is health and disease. Example of idea is coverage, effectiveness, impact, and efficiency. An example of object is hospitals and the health centers. And lastly, person is, example of a person is the healthcare provider as well as the consumer. That is the component of health system. Temitope, I hope you now understand it better now. So quickly, I'm going to unpack the National Council of Health. And under National Council of Health, we have the Honorable Minister of Health, which is the chairman. Then we have the Honorable Commissioners for Health. It's important, both of them are honorable, but one is Minister of Health, and the second is Commissioners for Health. What is their function? The functions are the development of national guidelines. They develop national guidelines, they implement and administer the national health policy. They also provide various technical matters on the organization, delivery, and distribution of health system, as well as they also advise by the technical committee. And who are these technical committee? We are also going to look at that. Who are the technical committee? The Technical Committee of National Council on Health is comprised of the federal and the state permanent secretary, the directors of Federal Ministry of Health, the professional heads in the State Ministry of Health, a representative of Armed Forces Medical Services, Director of Health Services, Federal Capital Territory, Abuja. So, who are the experts panel? The technical committee set up as required, appropriate program expert personnel. Panel, including the representative of health-related ministry. And so we said that health system is a whole. That is, it comprises of components which are sectoral and intersectoral components. And so we want to look at other sectors that make health system effective and efficient in function. We look at the agriculture, we look at the rural development and water resources, we look at the education, we look at the science and technology, you look at the labor, you look at the social development, youth and support, you look at works and housing, you look at the national planning, and lastly, the finance. All this representative makes up the expert panel of the technical committee that looks at issues of health system. And we looked at health-related bodies. We also have bodies. Who are they? We have several, but a few that is mentioned here is National Institute of Medical Research, medical schools, schools of applied health professionals, and the non-governmental organizations, professional associations. You have it there. And so that is a federal organization level that we've just looked at now. Please, ma, is international health among the function of Federal Ministry of Health? Yes, it is. It is. It is. It is. So we've just finished unpacking or explaining or expatiating on the federal organizational level of health system. And if there is any question, please quickly put your question on the chat before we move to the next level. Don't forget that I said that the 3 levels of health system that we have in Nigeria are the tertiary level, which is at the federal government level, the state level, and the local government level. So it's federal, state, and local government level of health system. In case it comes out, you come across it anywhere, don't forget that the 3 organizational health system level that we have is federal, is state, is local level. And so if there is no question, we are moving to the next level. We just finished the federal level now. We're going to unpack the state level. What is their function at the state level of health system? Each of this level has their functions and their responsibilities. And so we look at the state level. When you say state level of health system, we know that in Nigeria we have 36 states, plus the Federal Capital Territory, which is Abuja. And each of these states has their roles or their functions and as well as their responsibilities. So we want to look at the state level now, which is also called the Health Management Board. They also participate in the management at the board level. And so at the state Ministry of Health organization, the State Ministry of Health is headed by an honorable commissioner, while in Health Management Board, there is governing board with an executive secretary. So you have the commissioner, the honorable commissioner, and the secretary. It is a political head of the ministry, while the permanent secretary is the administrative head. And there are directors, manning the directorate, assisted by the deputy and assistant director. Functions of the State Ministry of Health. The State Ministries of Health dictates and coordinates authority on health work within the states via the following. Their responsibility and function is within the state level. They ensure political commitments, ensure economic support, win over professional groups, establish a managerial process, public information and education, financial and material resources provision, intersectoral action, coordination within the health sector, organized primary health care in communities, federal system, logistics system, health manpower, recruitment, and priority health programs, as well as health technology. You see that at the state level, they oversee the affair of the local government level, that is the primary health care committees. They also provide manpower and training. And so that is the state's organizational level. Are there questions or contributions on state level? Please, Mark, can you please explain more on the federal organizational level? Mike, what I will advise, like I always say that this 1 hour class session is not the only resources that you need. The PowerPoint instructional video that has been posted on the VLE page earlier is more elaborate and more explanatory. And so I will advise that we go back, download the PowerPoint instructional video, go through it, and you understand it in more details. So, but in summary, at the federal level, I mentioned that it's subdivided into two. That is the Ministry of Health and the National Council of Health. And each of these two components that made the federal level, or the acts at the federal level, as their functions and responsibilities. So you will see it in the instructional PowerPoint video. Go over and download it and learn more from it. Please, my expert panel, how do they function in health-related ministry? Like I mentioned, that the technical committee appoints this expert panel. You want to, let's say for instance, now there is a program that the country wants to roll out. They can't just roll out a program without seeking opinions or the advice or the expertise of the experts. You've got people you've got the scientists, the epidemiologists, the nurses, the doctors in different areas, the agriculturists, all those sectoral components that we mentioned. We've got people that are experts in this area. Then the technical committee formed a panel of this expertise, looks into the issue, and come up with objectives or the way to solve this problem or to roll out this program. That is the role of expert panel before a program is rolled out. And so, lastly, we are going to look at the local government, the local level of health system. And I'm just quickly going to share my slide on that. At the local level, we have 774 local government areas in Nigeria, with various health facilities operating under the hands of primary health care. The local government health quarters coordinate the activities of the health facilities, providing manpower, funds, logistics, light control. The local government is headed by elected chairmen during political era with council members. Supervisory councillors are also appointed to oversee various aspects of local government activities, including health and social services. The health department is always headed by a primary health care coordinator. So you have coordinator that at the primary health care at the local level. What is their function? 1, provide and maintain essential elements of primary health care. During when we discuss units under unit 2, we look at those essential elements. Those are the things that they want to ensure it is provided at the primary health care. Environmental sanitation, they want to ensure that the environment is maintaining sanitation. Health education on health issues. Design and implement strategies to discharge the responsibilities assigned to them under Constitution. Meet the health needs of the local community under the general guidance, support, and technical supervision of state health ministry. The health ministry supervises the local government level. And so we've seen, and so far, that is the 3 levels that we have. We've looked at the federal level of health system. We've looked at the state level of health system. We've just finished the functions and the role of the local level of health system. So far, that is what we are going to covered under Unit 4, Part 1 of this course, NSC 303. So we've come to the conclusion of Unit 4, Part 1. And I want to welcome your contribution so far. What have you learned? Before I give 5-minute quiz, let me entertain your contribution, your question. So ask your question before I give the short quiz, and we call it a day. Question, contribution. Abiola Janet, please next time, please put on your video. It's important that I see the student I'm facilitating. Okay, thank you. Let's always put on our video. Let's see ourselves. Question, contribution. Okay, while you're typing your question, quickly, for those of us that we are live on session, can you give me the component, the 4 components of health system? Quickly type on the chat, 4 components of health system with each example, and give one example of each of the components. Earlier on, I mentioned 4 components of health system, and I want you to quickly type it, the 4 components of health system with one example. Four components of health system. 4 components of health system with one example. Okay, concept, idea. Okay, concept, idea, e.g. Okay, health. Excellent. Object. Okay. Okay. Each person is to mention the 4 components. Person. Okay. Okay, person, provider, and the consumer. Excellent. Okay. Object, e.g. is hospital. Yes, correct. Correct. Okay. Okay. Idea. Okay. Example of idea is the impact, effectiveness, the efficiency. All right, you've all done well. Thank you for your contribution, and that's a good trial. And so far, that's where we are going to leave it for today. If there is question, you can quickly post your question. Let's address it. If there is no question or contribution, we're going to call it a day. Okay. Okay. Yeah, thank you. Thank you. Thank you. For those of us that we've attempt the quiz, you will get your mark for it. For every activities or every exercise that you participate, even your contribution in class, your question or your contribution also has reward. So you are not doing anything without getting a reward for it. So the more you get involved, the high chances of getting more marks. That is the secret of this life, class session. The more you participate, the more you get rewarded with marks. So I advise us to get more involved so that you can start building your marks. And at the end of the day, you see that it pays off. So if there is no question or contribution, at this time, I want to say thank you for logging in and attending the class session. Thank you so much. I'll see you same time next week, same day. You have a good, enjoy the remaining hours of the day and have a lovely week. God bless. Okay, before we go, please, ma, if we are asked to mention the level of organization, do we highlight all with the functions? No, if you are asked to list, when the question say list, you are just to itemize it. You just mention the federal level, the state level, the local level. But if you are asked to mention and explain or describe, then you have to explain each of the functions of this level. So take note, if you are just asked to mention means itemize. But if I need you to explain, I will say describe or elaborate or explain. Okay, so far, I think that's the question for now. So we'll address it. So thank you so much once again. See you same time next week. Have a good week.